So Cornelia, I have a question.
Yes, ma'am.
What time does your computer say? Because my phone and my computer are seeming to be out of sync recently.
My computer and my phone say 8:59.
Okay. I think my computer's a minute slow. So I usually rely on that for meetings like this. But I'm like, I feel like Apple might be more right than
Yeah,
who
but it's
knows.
asking me it's different because I thought yesterday was Sunday. So,
Okay.
it,
That is fair. That is fair.
it's I gotta go by my phone or my something or whatever. So
But yes, agreed. I like that. Thank you.
good morning, everyone, and welcome to the May meeting of the Early Childhood Recommendations Panel. My name is Cornelia Stevens, and I'm the Executive Director of Top Area Learning Centers in Wichita and have the privilege of serving as chair for the Recommendations Panel. This is a remote meeting, and today's meeting materials are posted on the panel meetings website at kschildrenscabinet.org. Panel members, we'd like to thank you for serving Kansas children, their families, and our state's early childhood care and education professionals. We know that you all have many things to do on your schedules, and so we appreciate the time you spend dedicated to really shaping the care and education of our children. Please clearly identify yourself when you begin speaking. So please state your name, and you have the option of raising your hand or using the raise hand feature if you have comments or questions about anything. That way, Lindsay and I don't kind of hop over your question or comment or whatnot. So either raise your hand or use the raise hand feature to make sure we don't miss you. For today's agenda, we will be approving the May agenda. We will approve the April meeting minutes that Lindsay already sent out. We do not have anybody slated for the open forum, but we'll talk a little bit about that in case we have anybody watching virtually who would like to learn more about how they can actually share information with the panel. We'll have an update on the All In for Kansas strategic plan, workforce development advisory group update, work group reports, bright spots. And so this is your heads up. So start thinking about bright spots. Start thinking about things that are happening within your organization, your community, or even at the state level that you'd like to share. And we'll talk about upcoming meeting dates, and then we will adjourn, and work groups will have an opportunity to meet following the meeting. So for the first action item, we will go on ahead and approve the May agenda. So the May agenda was sent out for everyone. So if there are no adjustments to the agenda, may I have a motion to approve the May agenda as presented?
This is Heather Schroeder. I move to approve the May agenda as presented.
Perfect. May I have a second?
This is Brenda Bandy.
Second.
Oh, go ahead.
This is Natalie McLean. I'll second.
All those in favor, thumbs up. Any opposed, same sign. Thank you. The April minutes were sent out. Hopefully we have all had a chance to review the April minutes. If there are no adjustments to the minutes, may I have a motion to approve the April minutes as presented?
This is Brenda Bandy. I make a motion to approve the April minutes as presented.
May I have a second?
This is Karen McCrory. I second.
All those in favor, thumbs up. Any opposed, same sign. Thank you. So as I stated, we do have the opportunity for Kansans to share information with the panel. If you have any thoughts or ideas about things that are happening across the state, things we should consider, challenges that you're facing, anything like that, we do encourage you to submit comments through the Kansas Open Forum comment form, which is on the Kansas Children's Cabinet website, by 5 p.m. the day preceding each meeting. And you have the opportunity to share written comments or sign up to share verbal comments with the panel during this portion of the meeting. Again, we don't have anybody today, but we do encourage and love to hear from Kansans about any information that you'd like to share. And so please again submit information to the Kansas Open Forum comment form so we can add you to the agenda. First on today's agenda, we will have an update on the All In for Kansas strategic plan, and that will be from Megan Clue.
Good morning, everyone. Nice to see you all. Again, I'm Megan Cluth with the University of Kansas Center for Public Partnerships and Research. Next slide, please. So I'm going to highlight a few of the many initiatives. We've got 29 initiatives across PDG, so it is a big grant, but we have been really busy over the past couple months and wanted to highlight some things. So I've shared that the Child Care Systems Improvement Team with childcare licensing has been hosting regional roundtables. They've done 3 to date. They're getting ready to do their 4th one next week in Garden City. So we're still taking registrations. We can send the flyer out with these notes if anybody is in that region and is interested in childcare. This is for families using childcare, anybody providing childcare, just anybody who's interested in the community. We would love to have people come and share a little bit about what's going well and maybe where there are challenges. And then I'll be getting Lindsay a flyer shortly. We are working on dates in Hayes and I think Pittsburgh, somewhere in Southeast Kansas. We're still confirming the date and the location, but those will be coming in June. So again, if you can help us promote those, we really appreciate that. And then that will conclude the regional roundtables for the year. Next slide, please. Okay, as I said, there are 29 initiatives across PDG, so I'm going to jump around a little bit, but wanted to highlight there are a lot of initiatives focused on childcare. Obviously, the one I just talked about is as well, but wanted to just share some kind of initial numbers and impact that some of our partners are having because it is really exciting. So some of you may know Robin Hanson, who has started a substitute model through her program Customized Early Education. It started in Abilene and Dickinson County and is now expanded to 18 counties across Kansas, which is a really big deal. They are partnering with 52 childcare facilities, and this allows providers to get a break and get a little bit of extra staffing when they need it. And so Robin and her team have been very hard at work at getting that program into as many counties as possible. And again, if you're talking to providers that are struggling with workforce, as we know many are, this is one way to help address that and make sure that childcare providers have time to take days off for professional development or just personal time off and all of that. So I'm happy to make connections with anybody who's interested in learning more about that program, but really wanted to celebrate how quickly that program has really grown. And I think we're just seeing that that is a big need really statewide. Another program that we're working with through PDG is Thrive Allen County, and they are expanding a model that they developed a few years ago to help childcare providers across the state get some reimbursement for health insurance. So they're currently supporting 171 childcare providers. I think it's about 2/3 of these are home-based providers, and the other third is center-based. And some of them, this is the first time they've ever had health insurance. So it's really, I think, a super exciting and impactful program. And again, something for us to be looking at the state and system level of creative ways that we can be kind of adding benefits and support for early childhood professionals. And then last but not least, Childcare Aware through their Baby Steps program is continuing to enroll more infants in care, which we know infant toddler care is a huge gap in many areas of the state. And so they have added 42 childcare providers across the state. They're targeting very, very high needs, particularly very rural communities right now through PDG. And so through the grant, they are helping make sure that 44 infants in Kansas get care. So I wanted to share a few snippets of impact happening, and I think these numbers are just going to continue to grow. And so I will share them as that happens. But I think these are 3 of many ways that Kansans are being creative and supporting childcare professionals and families. Next slide, please. I think those are all very big bright spots, but I have to say, I think the biggest bright spot of May thus far in PDG is the care conferences that were held in Garden Cities and Hayes last week. And I actually think some people on this call were there in person. So thank you for that. Thank you for anybody who made the trip out west. We appreciate it. So there were two events. We had 75 attendees, which included professionals and families, 28 resource tables, and I was really cool to see. We had a very solid early childhood representation, but I think we also our team took a proactive approach to reach kind of any sort of provider that might serve a young child. So it was certainly beyond what I think we would consider the traditional early childhood providers. So we had some healthcare providers, mental health providers, wellness groups, all of that, which was really nice to see that kind of community come together and say, we're all serving families and young kids. And then just the kind of a summary of the event, we've been describing it as like a third space. So the idea that, there are not a ton of places beyond maybe house your homes, your workplace, your childcare settings, those type settings where they're like kind of public settings where people can come together for like a common good. And so this third space was really designed to open up organic and meaningful connections for families and professionals who maybe are serving the same kid and maybe aren't, but a chance for local professionals to really sit at the same table with families and hear their experiences and see if that aligns with what they think, how they think things are going. So that was really exciting, I think, to just open that space up and see how receptive people were to it. And then we had some wonderful panel discussions and family stories. And I just wanted to highlight, we were talking to one of our partners, actually, Marie is here with CAME, and they were talking about that they really wanted to highlight the how much when any professional who's supporting when anyone, period, who is supporting a family with a young child, coming into those conversations with empathy and not being judgmental and being really responsive to needs is super powerful. And there was an instance of a woman who had really, struggled with some, I think, some addiction, and I think there can very much be a strong stigma attached to that, and was able to, with the right supports, go through recovery and is now thriving with her young children. And she was actually able to see in person a provider that really, I think, approached her with that lack of judgment and genuine support. And they were able to have a really meaningful moment in person at one of the meetings. So I think it was just, I think we all know that, but it's easy when we get busy to kind of forget. And I think it was just these conferences, I think, really highlighted sometimes if you're working with families, you don't necessarily know what happens to them and kind of how their story continues. And I think this created a space for some people to hear a little bit more about the impact of what they do every day and the ripple effects of that. So we are super proud of these events. We're going to host, the plan is to host two in North Central and South Central, so probably Wichita area, and then maybe like Salina, TBD, probably next spring. So stay tuned, and then we'll work our way east. But if anybody wants to know anything else about these conferences, let me know. And again, thank you for anyone who was on this call who attended. We really appreciate it. Okay, and then this is going to be kind of a vague update intentionally, but it's a little bit of a teaser because we're going to share more. You may have heard people across the system talking about, like, obviously we have the All In for Kansas Kids strategic plan, but like, how do we know that's working? How do we know that that's having impact, and where's their progress? And so the team at CPPR has been working on what we're calling a monitoring framework, which is basically a fancy way of saying just like a tracking tool. And so the hope is that this will really help us as a system be able to see, like, okay, for all of these goals and actions laid out in the strategic plan, 6 months from now, like, what work is happening toward each of those, and where there are things that it's like, ooh, somebody in the system really needs to be able to step into that. And so I'm going to bring a colleague in, in June or July to actually walk through that so you can see what that looks like. And my hope is that there are going to be some opportunities for your group to kind of see if there are areas where you're like, oh, I think this is something we could really support if there's work needed on the strategic plan. The strategic plan, as you know, is quite large and robust, and so certainly want to make it as transparent as possible so people can see where they can plug in and also see the good work that's happening across the system and celebrate that. So more to come on that. And I think that's my last slide. It is. So thank you all. I appreciate the space to be able to share. I know it's always a lot of information. And if you ever have questions about PDG or the strategic plan in between meetings, just let me know.
Thank you. Does anybody have any questions for Megan?
I
Okay,
do.
Hi,
okay.
Brenda.
Sorry. I raised my hand. Hey, this is Brenda Bandy with the Kansas Breastfeeding Coalition. Just curious because I saw the PDG grant was slated for on the federal level to be discontinued. And I was just wondering if you could maybe shed some light on what that or if that might impact our work here in Kansas.
Yeah, it's a great question, and I wish I had a better answer. I think the answer is we don't know. We are certainly aware of that. I think I think it's one day at a time, and we're trying to just see what happens. As we have not heard anything directly at the federal level that implies that that is that we should change anything with our next steps. So we are moving like full steam ahead unless we hear otherwise. Certainly we're keeping an eye on it, but honestly, I think at the federal level, we've felt pretty good about what we've heard, and I think we'll keep doing the work until something shifts. But it's certainly something we're keeping an eye on, and I think also being just being really mindful and strategic about this is really important work. And so if there is a shift, like how do we make sure that we're able to continue as much as possible with our partners and yeah, so I mean, I think we're trying to be as transparent as we can if we hear anything. But as of today, as of 9 a.m. on May 16th, we're going full steam ahead.
Okay. Thanks, Megan.
Yeah.
I would just put forward to the group that I think the recommendations panel is a group that's perhaps well positioned to be able to support and help if something were to change. And I would hope that, I know we meet monthly, but things are moving very quickly, that if things were to change, if maybe you could reach out or this group could be informed so that we might be able to respond and, kind of gather together resources and so forth and so on if needed.
Absolutely. I really, really appreciate that, Brenda. And I think, I mean, certainly PDG is top of mind for us, but we know a lot of partners are monitoring similar situations. And I absolutely. I think the more we can work together and keep the work going, and maybe that means thinking about it a little bit differently. We're here for that, and certainly we'll keep this a group informed. I appreciate you calling that out.
Thank you for the question, Brenda. I would be dishonest if I said I wasn't wondering if that was going to be part of the update as well. So I appreciate that because I think we're all patiently and impatiently waiting, for what's going to, but you never know. And I appreciate Megan, the drive or the focus to just keep on keeping on and doing the great work that we're doing until we hear otherwise. And so thank you for that. Any other questions or comments? Okay. If not, thank you again, Megan. And next
Absolutely.
we'll have
Thank
Chelsea,
you.
who will give an update on the Workforce Development Advisory Group.
Hello. Hi, my name is Chelsea Schulte, and I am here on behalf of the Workforce Development Advisory Group. We were so thankful to have Cornelia visit the Workforce Development Advisory Group to share about the work that you all are doing. And so we were excited to be able to come and share an update from the Workforce Development Advisory Group. We have a recommendation to share for consideration today for you all to be able to take back and consider in your work and share within your networks. But thought it was important first to give just a kind of an overview of the Workforce Development Advisory Group and the purpose behind that. So the Workforce Development Advisory Group was established in 2013 and is a function of the Child Care Professional Development workforce professional development contract that Casito holds. That is funded with CCDF dollars through DCF. The members of our group represent state agencies, professional development organizations, higher ed, and direct service professionals. Similarly to the makeup that the recommendations panel has. So our goal, as stated here, and our focus is really about using feedback from the field, both partners and those in direct care roles, to advance and improve the PD system. So you can see on that icon there, we've got kind of the Workforce Development Advisory Group as the center, but we have a number of work groups that meet to talk about targeted topics. So they're typically meeting more frequently, and they're assessing, planning, discussing, reviewing, and drafting recommendations around these topics. So some of the examples that you may be familiar with is the adoption of the new Kansas core competencies. Our core comp work group was heavily pushing that process forward, bringing the right partners together for that. The development and launch of the IPDP, the Individualized Professional Development Plan, along with a self-assessment, and also for years, recommendations to make progress towards a workforce registry, which is now a reality. So really exciting stuff that often start as nuggets of somebody saying, hey, we need to do better. And then taking the time to say, okay, well, how do we do that? What do we need to make that happen? So one particular area that we're working on right now is really trying to get more of the direct service professional voice to the table. So exploring that, and we may have more asks or information for this group as we move forward with that. But let's see, I think I want to just then pass it probably to the recommendation we're sharing with you today comes from the work of our collaborative TA network work group. And Stephanie Parks is the lead for that group. So I'm going to pass it to her to share with you a little bit more about that work group and the recommendation that we have for you today.
Hi, everyone. I'm Stephanie Parks. Thank you for this opportunity to be here today. I'm sharing an update on the work of the Collaborative Technical Assistance Network and our shared goal of building a more unified, effective, equitable TA system in Kansas. We've identified 5 interconnected priorities that are central to our work. First, and you can see the list here, the first is shared definitions, and I'll come back to that in just a second. Consistent TA documentation and reporting practices, especially as we are launching CAPE, with implications for uncovering the needs and highlighting the impact of TA across the state. A coordinated referral system, hopefully, to ensure programs and professionals get the support that they need out there. Shared leadership or shared relationship-based TA framework that's built upon the key principles and core competencies for TA providers across our mixed delivery system. And eventually a TA provider approval and recognition process. So each of these areas builds on the other, but the very first step, and the one that we're focusing on today, is our shared definitions. So why? Because shared definitions help us avoid confusion, duplication, inconsistency. Right now across the state, we may use the same words like coaching or mentoring, but they may mean different things depending on your program or your agency. And that might make it difficult for professionals to navigate that system and for TA providers to collaborate more effectively. And for us as a state to understand where support is happening and where those gaps exist, if you will. So establishing a common language ensures that we are aligned across agencies and our roles and regions. I just think it's essential for quality assurance and for clear communication and for building a data-informed TA system that works for the workforce that we serve. So that's why our shared definitions are our foundation, and everything else depends on getting that part right. So next slide, please. So this is the Training and Technical Assistance Glossary that was developed by NAUIC and CCA, I think in 2023, I want to say. Somebody correct me if I'm wrong. It is a nationally recognized resource that clearly defines and differentiates the types of supports that are offered in training and technical assistance to early childhood professionals. And it distinguishes between education, training, and technical assistance. And so it's kind of three bubbles, a Venn diagram that is interconnected. And it further breaks technical assistance into specific modalities: mentoring, coaching, consultation, and peer-to-peer TA. What we appreciate about this glossary is that it's clear, it's consistent, it's grounded in evidence and professional organizations that we highly respect. And so it helps us and our partners speak the same language when we talk about the kind of support that's being provided, how it's delivered, and its purpose, or what it's meant to accomplish, if you will. So I'm going to walk through each of those for us quickly. If you'll move to the next slide for me, please. Thank you. So let's look at mentoring. So this first type of technical assistance is defined as a relationship-based process between a more experienced professional and someone that is newer or new to the field or new to this role even. And the purpose is to build skills, confidence over time, as often through ongoing yet a little more informal support perhaps. So you might think of this as like a seasoned provider helping a new director navigate daily challenges, or a veteran teacher supporting a new colleague's growth. So it's about that relationship and that relational support and modeling and encouragement to build their self-confidence. Next slide, please. Coaching, lots of things are considered coaching, but within this definition, we are talking about coaching as more of a structured, goal-oriented process that is focused on improving specific skills, practices, and the coach, if you will, partners with the coachee. There's a plan, usually goals. They work together to reflect. They practice. There's modeling, often observation, and kind of feedback cycles, if you will. So this kind of TA is commonly used when there's kind of a more clear, measurable change, hopefully measurable change that we are supporting, something that we're really going for here. And whether that's a classroom practice or leadership skill or even program implementation. We're going to implement this, the pyramid model. We're going to implement ASQ screening. We're going to implement, whatever. So that's coaching. And there's kind of that's how it's a little more goal driven, if you will, and structured. Next slide, please, is consultation. And consultation involves a content expert, hopefully, obviously, with some knowledge also about adult learning theory, working with a program or an individual to help solve a problem or make a decision, or that relationship might be shorter, it might be a little more focused, but it's on a specific issue like health and safety, or an environment, or inclusion, or business operation or something. So what's important here is that the focus is on the expertise and that collaborative problem solving. So it's not just advice giving, it's not just sending out a resource. It's more a process of building capacity and supporting informed decisions. And then the last one that I wanted to talk about today is that's in our definitions is peer-to-peer TA. And this is often more informal, but it's also very reciprocal. And it happens typically when professionals that have similar roles or things in common or experiences in common, when they come together to learn from one another and to support one another. So this could look like a network of directors sharing strategies, or infant toddler teachers across programs connecting to discuss challenges and successes. I tried this, it didn't work for me, don't do that. Try it this way maybe. Sometimes there may be a book study involved. It may be facilitated by someone else, but it mostly involves that building that shared wisdom and professional community. So we often hear communities of practice that would fall under a peer-to-peer, professional learning communities that might fall under peer-to-peer. So those kinds of groups that are sharing and building on one another's wisdom and strengths, learning from one another. Next slide, please. So those are the kind of definitions that are found in this glossary of documents. So as a next step, we're asking for your support in these shared definitions and in adopting these shared definitions. And so we invite you to begin using them within your organization's work, whether that's staff training or your documentation or just your communication with one another. We also ask you to share not only within your organization, but within your networks or beyond where you have influence. So the more aligned we are in the language that we use, and the stronger our TA system will be. And so this is foundational work, but it's simple, but it's really important because it sets the stage for everything else that follows, from our framework, global kind of relationship-based framework that we are trying to build and map out, to our shared competencies, our coordinated referrals. We have to have a common language. So if you have thoughts or ideas or questions, please reach out to me or Chelsea or others in our that may be representing your organization within the TA network, if your group does some technical assistance. So we want to hear from you, and our system needs your support, and we welcome your partnership. So if there's any questions, please hit us up. And thank you again for your time and for your leadership and supporting the early childhood workforce and technical assistance across the state.
Thank you, Chelsea and Stephanie. Do we have any questions at all?
It's a comment, Cornelia. This is Marita Salton. Stephanie and Chelsea, I really appreciate the definition that we can use within our networks as well. So we're the same.
Thank you.
I did get a question about, people already thinking about, okay, well, what does my work look like and where does this fit into these definitions? So I guess I would pose back to Stephanie, is the correct answer there, if they're having those thoughts, to connect with you and to work through what that might look like? Because I think those will be, and to get involved with that, if you're interested in getting involved with that work group as well, the first step is to fill out the form linked here to become a part of the Workforce Development Advisory Group. And then you have the option to then join any subgroups. But even if you don't have capacity to get involved with that, I think those conversations with Stephanie or another member of that TA work group helps to give a bigger picture to what's happening in the state to help make sure that the system that is built works for the whole system.
That is the goal. That is the goal. We want it to be broad enough that there's an umbrella that everyone can fit under, and that we all feel that we have a place there when we are all, because TA looks really different across all different organizations and different states, different places within the state. So yes, we invite all, and we would love to hear your feedback and see what we need to do to further refine all of this work. So thank you. Thank you for your
and I guess one thing I did want to point out, you all received the formal recommendation that went out with your meeting materials for today. So there's a little bit more there about what was looked into and all of that. The one thing I want to point out is that we shared this, the glossary. The recommendation is specific to adopting the TA definitions out of here. There are definitions about education and training and lots of other good stuff in here. But this TA group was not necessarily leveraged to say we should adopt the whole glossary. Not to say that maybe we shouldn't. So that's something I think that we'll continue to explore, but wanted to point out that we're truly just talking about the TA definitions right now.
And the document that that Chelsea is referring to, the actual update or recommendation for that we shared, I think that was shared with you in your email, has the kind of the process that we went through, the review process, all of the interactions that went back and forth, lots of filling out forms, going back to different agencies, coming back, having lots more discussions. So this has been a process that's been in the works for a while. Wasn't something we just let's use this. We really did some work in trying to make sure that this was going to be representative for folks across the state. So yes, please give us feedback.
Any other questions or comments? No, well, again, thank you for sharing the definitions. For one, taking it back to my team so we can kind of, frame that around the coaching, support, mentoring, et cetera, that we do. And so, so thank you again for joining and sharing the recommendation to the panel. Next, we will have reports from our work groups. And so to start us off, may I have a spokesperson from the Family Friendly Workplaces work group?
Yes, Cornelia. Hello. This is Brenda Bandy with the Kansas Breastfeeding Coalition and one of the co-leads for the Family Friendly Workplaces. As you've heard from previous panel meetings, we have been hard at work doing research on what else is happening around the country around designations for a family-friendly employer and workplaces. So we have quite the spreadsheet going of all of the designations around the country. We've had several meetings with other states. As a matter of fact, we have one coming up next Tuesday with Oklahoma. We just discovered our neighbor has a designation. So we're trying to learn from other states and compiling a list of best practices. And what we have come up with so far for best practices, just very high level, is that we want to make sure any designation in Kansas has a robust set of criteria. So the designation is meaningful. We also know that we want it to have significant TA so that employers can move through a designation. If there were, say, bronze, silver, and gold, we want to help them to, if they got the bronze, move to a higher level of a designation. So we've seen other states use that very strategically. So we think that would be important. We also think it's essential that a designation include feedback from the employees. And this would be a survey of employees. And we're thankful that here in Kansas, we already have such a survey that the Kansas Power of the Positive has been administrating for several years. So we know that employee feedback is going to be essential. And many states, include that as part of their designation process as well. So we have this list of best practices. We also have a draft of a recommendation that we had sent to Melissa Rooker at the cabinet for her feedback. And we are hopeful that we will be able to submit to this panel that recommendation at the next meeting. And then we know that the work groups will kind of reconfigure or restart in July, and then we'll see where our work goes from there. Or what their work goes. I don't know. I may not be there, but we'll see. But that's what we've been up to, and we invite feedback. And yeah, there you go. Any questions?
None. Thank you for the update. May I have a spokesperson for the exit interviews work group?
Good morning. This is Natalie McLean. I will be speaking for our group today. The exit interviews work group is coming really close to having a formal recommendation on exit interviews for those leaving the early childhood field. Before moving forward with this, we wanted to make sure that the recommendations we were hoping for would be well received by the parties mentioned in the recommendation, namely the CAPE portal. So we met with some members of the CAPE team last week to discuss possibly housing that exit interview within CAPE. And after speaking with them, we think it makes good sense for our recommendation to be that it is housed there. So with that information, we're going to continue moving forward, and we'll soon be sharing our draft recommendation with Melissa Rooker for feedback. Any questions for our team?
None. Thank you, Natalie. May I have a spokesperson for the mental health supports work group?
Good morning. This is Hillary Kane with Kansas Parents as Teachers Association, and I'll be sharing an update. Lindsay did help to make a connection between Megan Cluth and myself in between our meeting times in this last month so that we could have some discussion around the efforts that are taking place, as you guys just heard a little bit about, with PDG and the strategic plan, and just kind of being able to talk through what our group is talking about, the work that's already happening, and thinking intentionally about what that might look like in order to be able to work together on some pieces. So Megan and I did have some really good conversation, and our group will be discussing that in further detail today when we meet.
Good. Thank you, Hillary. May I have a spokesperson for targeted journey recruitment?
Good morning. I was waiting to see if Amy had popped on. I will share the update for our group. I'm Kim Kennedy. I'm with the Department for Children and Families, and I'm the Head Start Collaboration Director. And just a quick update from our work group. We are currently, our group has been reviewing the resources that are under the resource tab for workforce on the All In for Kansas Kids website to look and see what updates might need to be made in that area or what additional information could be added regarding workforce supports. And we've been working with, Amy reached out earlier in the week to Rachel Sisson with the KU team, and so she will be assisting us with making those updates or additions. And then Amy also contacted Marie with the mental health supports group to see if there would be any additional resources that they would like to have added to that tab as well. So that's kind of where we're at with our group. We're just continuing to review and to see what additional information can be shared to support the workforce.
Okay, thank you. Any questions? Questions or comments from anyone? If none, may I have a spokesperson for Systems Progress Communications?
Good morning, everyone. This is Kelly France Langford. At our last group, we finalized our questions, drafted questions that we are going to send out to help analyze communication between work groups. Our objective was
to gain a clearer understanding of each early childhood work group's mission and scope, just to make sure we had it covered, and then really start to evaluate how information is communicated both within that group, between the groups, and then within the early childhood system as a whole. So the Google form the questions were sent to Lindsay just to make sure we weren't duplicating anybody else's process, so our own communication was clear. Excuse me. The Google form has been built, and now I just have to share it out. And I think that's all. Any questions for us?
Well, thank you again for the update. Thank you all for the work that you are doing. It's great to, to see all of the progress moving forward, and I'm anxious to hear about all of the recommendations that are being made. For the June meeting, we are asking each panel to prepare a presentation, which kind of summarizes everything that's happened over the past year. This is going to give an opportunity for us to kind of close out the year and also maybe provide information to any new panel members that'll be kind of hopping on in July. And so, Lindsay, do you have anything to add to that, or is that enough?
I will try to include some information in my follow-up email to you all, but basically just be prepared to share how the year has gone, what your discussion has been, what your progress has been, the efforts that you've put forth, just to help. I know we've talked about it every month, but it's a nice way to sort of summarize all of the great work that you all have put together. Also thinking about handing your work off to future work groups in July. So trying to make sure that they are well set. Hopefully many of you will be here and will be participating in the work on an ongoing basis, but obviously we'll have some turnover and new members. So making sure that they're really well set up to continue your work. If you do have more formal recommendations or really anything that you want feedback or input on from Melissa, please send that to me and I will help make that connection sooner than later because she has a very busy schedule. So I want to make sure there's enough time to make that happen. And we can help with that iterative process to keep the work moving forward. I'll share a slide deck with you to work, but you can always just send me bullets and I can build out slides for you too. So if you have any questions or need any help or support, always feel free to drop me an email and I want to be available to help support your efforts. So just reach out.
Thank you, Lindsay. So hopefully all of you or most of you completed applications to continue your work with the Early Child Recommendations panel. Hopefully all of you reapplied. And so that actually the application panel for the panel has closed. And so we are going to confirm all of the new panel members at the June 6th Children's Cabinet meeting. And so you all will receive notification or whatnot in terms of, being placed on the panel again for this coming school year. School year. You could tell that I'm ending a school year, right? So this coming year. It is a 1-year term from July 1st, 2025 to June 30th, 2026. And you can visit the Kansas Children's Cabinet and Trust Fund website to learn more again at kschildrenscabinet.org. Next, we have the opportunity to hear about bright spots. So does anybody have any bright spots that you would like to share with the panel this morning? Amy.
So
Sorry, this is Amy Gottchammer. I was just going to share that this last Wednesday we had a wonderful event at our school at Googles of Learning. We call it our Wonder Woman Wingding, and it is an event for a breakfast where we invite all of the important women in our children's lives, be they moms, grandmas, aunts, stepmoms, dad's girlfriend, whoever is important in the children's lives, to come and have breakfast with us. And we had 121 respondents. And so it was a big event and we had it catered and everyone had a wonderful time. And so it was just wonderful. And so we'll celebrate all of the important men in their lives next month. So we just had a great turnout and it was a wonderful activity. So I just thought I'd share.
Cool. Wonderful idea. Brenda.
Thank you. This is Brenda Bandy with the Kansas Breastfeeding Coalition. And I have two things. One, I kind of want to share a bright spot from one of our partners, which is CAME, the Infant Mental Health and Young Child Association. I was at their conference this year and I was blown away by the number of childcare providers that were at that conference. So whoever is making those connections and making that work, I just want to say kudos, because that was an amazing number of childcare providers that we were then able to talk with about our breastfeeding or childcare awares breastfeeding friendly designation. The second thing is I just wanted to remind the group that we continue to host our first Friday policy updates. Our next one will be on June 6th, obviously the first Friday of the month. They are 30 minutes from 9 to 9:30. And the speakers that we have lined up for June 6th are amazing. We have a guest speaker from the federal representatives with Moms Rising to give us an update on what's happening around maternal and child health issues on the federal level. And then on the state level, we have three speakers that will be with us, one from the state Medicaid office. And all three speakers are going to be talking about new activities that are being brought to Kansas from federal organizations. And it's kind of something to celebrate amidst some of these times where we don't have quite as much to celebrate. June 6th will be a chance to celebrate the start of new work in Kansas.
That sounds awesome. Thank you, Brenda. Any other updates? Jarvis?
Yeah, good morning, everybody. So I just wanted to throw a shout out to Christy, Child Care Aware of Kansas, and also Sarah with Child Care Aware of Eastern Kansas. I got the opportunity to attend the Child Care Aware of American Symposium last week, and there was a point where in the conference we got to do some planning around Advocacy Day. And so I didn't get a chance to tell Christy and Sarah this, but it was great to see all of our Kansas team together in a room. I just sat back as a state employee. I didn't join in, but I got to sit back and watch them plan and be strategic about what they wanted to take up to Capitol Hill that next day. So I just wanted to throw a shout out to them to watch them plan for Advocacy Day and her and her team. And it was just great to see them work together and come up with a plan for Kansas as they went up and presented what we had. So kudos to them.
Thank you, Brenda. Maritas, did I see your hand up?
Yes, I put my hand up. I just want to share that my team has created some sensory activity bars to help exploration for young children with visual impairments with the Infant Toddler Services of Osage County. And there's another one I could not remember, but I think that's really cool. The other one is our early childhood enrichment program at the Kansas State School for the Blind is up and running. If you would like to come and visit, feel free to let me know. And the third one, I'm inviting all of you to participate at the KC Blind All-Stars 5K in September. It's virtual, so you have no excuse. You can walk in your home. It's a run and 1 mile walk. It's our biggest fundraiser, so we're really excited for it.
That is my motivation to get off the couch and to get up and move around when I get home from work. And so thank you for that invite. That's going to be cool. Any other bright spots? Cortez, do you have information that you can send out about the run walk event that you can share with Lindsay and she can send it out to people?
Absolutely. I'll be so glad to do that.
Okay, thank you.
Thank you.
I had a bright spot.
Go for it. Hello there.
This is Larry Lewis with Growing Futures Early Education. So this past month, our home visiting program, does a lot with parent engagement. And so they decided for around the season to host a prom for all of our parents and provide childcare. And so they took this opportunity to allow the parents to go to some consignment shops and pick out clothes and dresses and tuxedos. And they got to choose what type of music they wanted. So we had a DJ there and we brought them into the school and provided childcare for the night for them. And it was just a beautiful experience. It was great to see, so many parents engaging in that capacity. And so many of them said, I never went to my prom. So it was a very touching experience to just see people get the opportunity to engage and kind of go back and remember what it would have been like or what it was like for them to have gone to prom and to have one as adults and not have to worry about the kiddos for the night and just have a good time enjoying one another's company and the fellowship amongst the group collectively. So I thought that was an amazing experience we were able to put on for our families.
That is absolutely incredible. Parent engagement is so important, right? And so to be something that's specific, like to the parents like that, as you said, who maybe have never had a chance to go to prom. And so that, I'm sure that you have amazing pictures, of that event. And I know that your parents definitely valued that. So between your prom and Amy's Wonder Woman event, I have things to talk to my staff about, in terms of, fun things that we can do, next year. Thank you for sharing, Larry. Tabitha.
Yeah, good morning, everybody. I just wanted to shout out, Brenda said something about the CAME conference, and I was keynoting that day, working all day with the early childhood providers, and it was incredible. The turnout, the participation, the vendors, the passion, and as well as at the Kansas PTA or Kansas Parents as Teachers. Sorry, I do PTA too, get confused. Conference recently. I really just unmuted to say that early childhood providers are out doing the work in Kansas, and I'm just so grateful to be a part of it in my work with KPERC.
Thank you, Tabitha. Any other bright spots? Okay, if none, thank you all for sharing. I think that, as you can tell, no matter how big or how small, it's great to hear about the wonderful things that are happening within your organizations or within the community. So, and across the state. So thank you. As a reminder, you are going to receive a post-meeting survey from Lindsay. So please please complete that when you receive it. Just gives us an opportunity to just review whether or not you feel like the work that we're doing as a panel is meaningful, and address any concerns or anything like that that people may have. The next Early Childhood Recommendations Panel meeting is going to be on June the 20th at 9 o'clock. So remember, on the 20th, that is the date that you will be giving your presentations from your work group. And so again, that's going to be on June the 20th at 9 o'clock. The next Kansas Children's Cabinet and Trust Fund meeting will be on June the 6th from 9 to 12, and it is going to be live streamed on the Kansas Children's Cabinet YouTube page. We are going to go on ahead and adjourn. We're going to call it 10 o'clock. As opposed to 9:57. So you guys will have a 15-minute break. And so at 10:15, please go on ahead and hop back on and join your work groups if your groups are going to be meeting today. Lindsay will have the breakout rooms open and available for you. And I hope that you all have a wonderful end of your school year. If you're on a school year calendar, I hope that you have a wonderful beginning of your summer. The weather is actually getting beautiful now out. And so I hope you take time to go out and enjoy the beautiful weather. So you all take care and have a wonderful weekend.